So in the United States, sacituzumab has really gone into our second line of therapy. So it's approved for patients with metastatic triple-negative breast cancer who have had 2 prior lines of chemotherapy in any setting, either the neoadjuvant, adjuvant, or metastatic, and at least 1 line of prior chemotherapy in the metastatic. So in the United States, I am typically bringing this drug into the second line of treatment for the patients with triple negative breast cancer. Again, because the ASCENT study showed a significant improvement in overall survival from 6.9 months to 11.8 months for those patients. It was very well tolerated with a predictable side effect profile. So for HER2 low patients, I typically ER positive HER2 low patients, I will typically use Enhertu and then sequence sacituzumab or Trodelvy after Enhertu. For a patient who does not have HER2 low, who is not HER2 low, who is IHC 0, then of course they would not be eligible for Enhertu. And if they were ER positive IHC 0 on HER2, then we would use Trodelvy.